Morning everyone. Today, parts of Western Australia in the Perth, Peel and Southwest regions have entered into their first full day of lockdown, following the serious situation that came to light yesterday. I'd like to thank all Western Australians for their response thus far. So many West Australians have been cooperative and understanding, which is exactly what we need right now. This has been a rapidly evolving situation. I know it has been difficult and I know it may have been frustrating. But if we can all work together and do the right thing over the next few days, we will increase our chances of crushing the virus once again. Just like we've done before. The early signs have been encouraging. People have largely listened to the instructions. I noticed this morning many people undertaking the permitted 1 hour of exercise and they were all wearing masks. It's good to see, so thank you very much to all those West Australians. We need to keep it up, at least until the end of the week. Listen to the instructions, stay at home, look after one another. I'll now provide you with an update of the COVID-19 situation. As you know, since the hotel quarantine worker returned a positive test, our contact tracing and testing teams have swung into action. Overnight, Western Australia has recorded no further local cases of COVID-19. To repeat, no new local cases of COVID-19 and no new overseas cases in hotel quarantine. Yesterday, 3,171 tests were conducted at our public COVID clinics. A majority of these tests were done in the afternoon and evening, and normally we not only have about 500 tests on a Sunday, so that number, the increased number, is welcomed. But we need to get more tests done, and I will talk more about that shortly. There has been extensive testing of the close contacts of the positive case, and that will continue. In total, 13 close contacts have now tested negative. And of those, 11 high-risk contacts have been moved into hotel quarantine as an extra precaution. In total, to date, we have identified 66 close contacts, all of which have been tested or will be today and will remain in quarantine. As the contact tracing team does further work, the number of close contacts could also increase. These are encouraging signs, but it's still early days. As flagged yesterday, anyone who has visited the list of known hotspots should get tested as soon as they can. The full list of exposure sites can be viewed on the Healthy WA website. This morning, one additional location was added to that list, a convenience store on Milligan Street in the city called Grab and Go. There will be a lot of people heading to COVID clinics over the next few days to get tested. This is expected, and we are putting in additional resources at the clinics to help manage the increase. All of our COVID clinics across the Perth metropolitan area will remain open until 10 p.m. at night. People can also get tested at private pathology collection centres, including the various drive-through facilities. The full list of these is available on the Healthy WA website. We're doing everything we can to minimise delays, but people will need to be patient. As experienced across the country and across the world, lines at testing clinics are the norm, as testing someone for COVID-19 is not a quick process. I know it's hot out there, so please, if you're going to get tested, bring some water and wear a hat. By getting tested because you are either sick or have been to one of the exposure sites at the times published, you are performing your civic duty as West Australians, so thank you. The more tests we can perform, the better we can manage this situation. I also want to acknowledge our health staff at these clinics who are doing a great job, working longer hours than they expected at the drop of a hat. Thank you for the service you are providing us all. As I said, it's very encouraging to see people listening to the advice around masks. We need to keep it up for at least the rest of the week. I want to assure West Australians that we have a large number of masks available. I understand there are people who, for whatever reason, have not been able to purchase a mask at this point. Police will be taking a common sense approach in these situations while people adjust to the new rules. The Police Commissioner can talk more to this, but can I thank the police officers for the role they are playing and for helping provide masks to people who do not have one. We're also distributing masks to community organisations to ensure that vulnerable people in particular can access a mask. In terms of travel around the state, as you know, the Perth metropolitan area, the Peel region and the southwest region are now in lockdown. Anyone in these regions should not leave during the lockdown period. People can enter Perth, Peel or the southwest only to access or deliver essential health and emergency services and other essential requirements, or to return to their home. WA Police have established 7 checkpoints in the Perth area and another 8 in the regions. Non-residents currently in Perth, Peel and the southwest are required to remain until the end of the restriction period, unless you meet an exceptional circumstance. Police will ask you to simply justify why you need to be out and about during the lockdown. If you need to travel between regions, please ensure you have supporting evidence, like a letter from your employer or evidence or a medical appointment. For the purposes of this lockdown, like we did early last year, Perth and Peel are treated as one region. So if people do need to travel for one of the 4 reasons, they can do so between Perth and Peel. A G2G pass system for this regional lockdown is in development and is expected to be rolled out later today. This is like the system we had in place when we had regional travel restrictions. We have been here before, we know what is required, and our police are getting it done. I also just want to clarify a few things from overnight. Overall, the message to everyone is to stay home. During this 5-day lockdown, we want as many people as possible to stay home and minimise movement as much as possible. There are 4 reasons only to leave home, and I ask everyone to follow these rules. WA Police have provided a list of essential workers, and it may not be perfect, but for this short period of time, we are asking people to apply common sense. If you must work, and you cannot do it from home or work remotely, you may leave home, but it has to be for an essential purpose. For example, FIFO workers. We have communicated with all companies that no one should be leaving Perth, Peel or the southwest regions to fly up to a mine site this week, with some limited exemptions, especially for specialists required to keep mines operating. We're asking everyone to do the right thing here. Childcare, for example, have been allowed to stay open, but only to provide care for children of essential workers. I have to say, I was disappointed to see some of the vision of people panic buying at shopping centres yesterday. There is just no need for it. As we've always said, during lockdown, people are permitted to visit the shops to pick up groceries. I urge people to be reasonable and only take what you need. Think of our elderly citizens who may not be able to get to the shops easily. There will be enough supplies for everyone. To assist, I can confirm we have permitted Coles and Woolworths to open an hour earlier from 7 a.m. over the course of this week. This is primarily to help older West Australians and to help limit the rush. Please check if your local store is opening earlier, as that is up to each individual store. Can I say again, the most important thing is for everyone to remain calm and refrain from panic buying. It's completely unnecessary. Also, non-essential retail shops are now closed as part of this 5-day lockdown. On Friday, we announced that WA's mandatory contact register system, Safe WA, would be expanded. This expansion includes businesses such as retail venues, certain types of commercial transport, takeaway services, certain outdoor functions and gatherings, and visitors at all WA private and public hospitals. The changes were due to come into effect from Friday, February 12. In light of the new situation we find ourselves in, the expanded Safe WA system will now come into effect from 6 a.m. tomorrow. Contact tracing is one of the most effective measures in controlling the spread of COVID-19 if a community outbreak occurs, and ensures potential chains of transmission are interrupted. That's why it's absolutely vital that everyone downloads the Safe WA app and use it every time you visit one of the listed venues. This will now also include takeaway services. So when you're picking up lunch or dinner, or even a takeaway coffee, you must scan in from 6 a.m. tomorrow or fill out the contact register. To be clear, every venue also needs to provide a paper-based contact register system as well. So if you do not have the app, you can leave your name. We all have a community responsibility to keep one another safe. I also want to thank all businesses for their cooperation to roll out this in a sensible and manageable way. As mentioned yesterday, investigations are underway to find out exactly how the hotel quarantine worker picked up the virus. As you would be aware, we have had a number of reviews of our COVID-19 systems, including from our Auditor General, the National Review into Hotel Quarantine by Jane Holton, which was released by National Cabinet, and the National Contact Tracing Review by Dr. Alan Finkel, Dr. Taryn Wiramanthri, and Lee Jasper. All these reviews found our systems to be sound. However, given the latest incident, a further review of WA's hotel quarantine arrangements, processes and procedures will be undertaken immediately, including any learnings from incidents in other states and internationally, and recent incidents in WA. The review will be led by Professor Taryn Wiramanthri, previous Chief Health Officer in Western Australia and the Northern Territory, and participant of the National Review of Contact Tracing by Professor Finkel. I can also announce today that the WA Police Force will launch a full investigation into how this COVID-19 case came about. We must get to the bottom of what happened. WA Police will allocate strong resources to this inquiry, this investigation. They have the forensic expertise to do the work that is required. This will run in parallel with the review led by our former Chief Health Officer. We will leave no stone unturned to ensure we find out exactly what happened to prevent it from happening again. Thank you. The Police Commissioner will now add some comments.
Good morning. I'll make a comment on a number of matters and then questions no doubt will follow. In respect of what the Premier just announced in terms of a police investigation, I'll call this case 903. That's the number of people that have been infected by COVID-19 since the commencement of last year. The police inquiry is complementary to the Department of Health. To complement their contact tracing, it is not a criminal investigation, but we must know what went on. And with that, this particular individual in case 903 has been very mobile in the community. We need to establish very clearly not only what happened at the hotel, but his movements, when, where and with whom. And that will, I think, certainly assist us in all understanding exactly when and with whom this person was moving, and of course what initially happened at the hotel. I might comment on a couple of other matters before I conclude. In respect of masks, we've had excellent community support in the wearing of masks. Since this announcement about this time yesterday, I've had no adverse reports about people failing to wear masks, but we do accept, while people are being very responsible, masks must be worn at all times when you are in the community, in public. The rule is, if you're outside your own home, the only time that you cannot are permitted to be about in the community is if you're the sole occupant driving a vehicle, or if you're exercising and swimming at the time. If you're exercising without swimming, that is, if you're walking, jogging, you must wear a mask. Children under the age of 12 do not have to wear a mask at any time. But what we would complement the public health advice is that if you want to act responsibly as a parent and your children are able to wear a mask, it's a good example, and while they don't need to, if you're able to and the children are willing, then wearing a mask is a good thing. If you go to work, you must wear a mask at your workplace. That is important in terms of limiting the spread. Even in your own office, that is a requirement. The way police are approaching this is that we understand that not everyone in the community has yet got a mask right now. There is a large supply of masks available. It's a big adjustment, we understand, for the Western Australian community, but we're confident that people, in fact I've been out in the community late last night and early this morning, and I've seen all people wearing masks, and we thank you all for that. There will be some challenges, we appreciate that, but one of the hallmarks of the way in which Western Australians have responded over the past year is that police have not had to use a big stick approach with this. I call it policing by consent. The community, if they're not wearing a mask, police will talk to you and approach you. If though you are willfully disobedient and belligerent about that, I call it the knucklehead rule, and if you're not going to wear a mask and one's available, you will get fined. So this is not an excuse for you to say, I don't want to wear a mask. What we're saying is, if you've made every effort and you are on your way to getting a mask for the immediate period of time, we want to work with the community, and that's what happened in WA last year, and we expect the same will apply now. We've not fined as many people as has happened in other places, and I think the way it was approached last year with our community, people have been very responsible. The starting point is really in the Perth metropolitan and Peel areas and the southwest. That's the immediate regions that are under this lockdown rule. What's the reason for that, and why is it 5 days? On the advice of the Chief Health Officer, this immediate 5-day period is critical, that we limit the movement of people in the area where this case 903 has been out and about, and we know that he is infectious, and we've got advice today of the strain being the UK variant. So in that space, we just need to support the Department of Health and all of the contact tracing, and that's why we're limiting the movement of people. Don't look for a reason to go outside unless it's essential. Yes, you are permitted to exercise for 1 hour within a 5-kilometre radius of your home. You can't drive 20 kilometres to the beach and then exercise. You must only exercise within a 5-kilometre radius of where you live. In regard to the essential workers, there are quite a lot of questions out there because we are putting in place quite a stringent rule around this. Everyone needs to start with the assumption, unless you're an essential worker and you can stay at home, stay at home. That's the clear message. But obviously, essential workers such as doctors, nurses, police, emergency services, but it does also include people that are operating in critical infrastructure, such as in the roads, the construction industry. There's a full comprehensive list of this on the wa.gov website, and that does provide, under the directions, a full list of eligible essential workers. We have, as the Premier has mentioned, strong engagement with the resource sector, and they have advised that they will adjust their shifts, their swing shifts, so that we're not moving people around the state unnecessarily. But I'm amending the directions that I signed last night to ensure that if there's critical, essential work that has to be done to keep our mines and the operations going, that is permissible. We recognise that. We're thanking the industry for their strong cooperation. And what does mean that people will have to make an assessment. If you're unsure, please contact police. The situation in regards to supermarkets, we saw long queues yesterday. I reinforce what the Premier and the Minister for Health said yesterday. Don't panic buy. There's no need for you to panic buy. Yes, there are long queues, and we've seen some again this morning. We have deployed police across these supermarkets as much as we can. I've not had any reports of violence or anything like that, but again, this is a lockdown over these 5 days. If you've got enough supplies for that, then don't go out and panic buy. In terms of travelling between regions, as the Premier just announced, and I'll reinforce, we have numerous checkpoints, 7 in the Perth metropolitan and Peel area and 8 in the regions. That will also be complemented by random police patrolling. We did see a number of people fined last year when we had these regional patrols, people that are wanting to travel for reasons other than essential work or compassionate reasons, that is permissible. But you must work within the directions. We have, in fact, this morning turned around some travellers, I understand, that wanted to travel for reasons other than, for instance, holidays. You can't go out of the Perth metropolitan area if you want to tow a caravan and go on a holiday. You must stay within the Perth metropolitan area. The company that has developed the G2G pass is reinstating the QR codes. They expect that that should be available by this afternoon. Last year, we had nearly 1 million vehicles across the WA internal borders in which we were able to work very closely with the community, with the truck and freight industry, and the QR code system worked very, very well. So we expect that that will be replicated. In the meantime, please bring with you, if you don't have a QR code ready and available yet, documentation that authenticates your work as a driver who needs to go somewhere for your essential work. And it's very important, of course, that you wear a face mask when you're driving. You can do it without a mask in a vehicle, but of course you'll need it the moment you step out of it. So everyone needs a mask. And Premier, did you want to take questions before I do?
I'm happy to. Should we just keep going?
Keep going.
Commissioner, obviously there's some concerns then about what happened at the Sheraton 4 Points. How happy are you to keep it in place as a quarantine hotel right now?
Well, look, we base this on the public health advice. What we do know is that since April last year, there has been zero contact that has been between workers at the quarantine hotels that has resulted in any infection. So for nearly a 10-month period, we've had a tremendous system. I think what it is of concern that the Chief Health Officer has briefed us on is that the variant strain here is, on the advice, 50 to 70% more transmissible. So clearly the environment has changed, and that's the purpose of this review. One, as the Premier has announced, will be on a clinical basis, and from the police inquiry is to establish the exact veracity and movement of this particular case.
Doesn't the regime that's there right now question whether something's gone wrong in terms of one person being able to cause all this panic? I mean, is there not a chance that there's still problems right there at the hotel?
There is. So that's in fact why the inquiry has been established, and Professor Wiraminthri will complement that as well. He's one of the most experienced public health physicians in the world, so he will complement what Department of Health and the police are already doing. We've had the Finkel review. What this means is that we know there's a transmission that's occurred, and with that we're reviewing it again and again as we must, and we are.
What about the protocols? What about the protocols that were in place, and are you going to change them? Because this bloke was symptomatic. He didn't come into work, didn't ring any alarm bells, went to a GP a day later, didn't go and get tested for another couple of days. I mean, it's sort of all kinds of stupid, isn't it, when you sort of look at the outcome?
Well, clearly because of what we now presently know, he's contracted this, it would appear, and this is yet to be absolutely confirmed, from a person who's in quarantine. Exactly how we presently, as of this minute, do not know. That's what we need to establish how. We have obviously had some breaches in the past where people have not stayed in their hotel rooms. On the advice that the Department of Health have told us, this particular security guard, there's no present evidence that he's gone into a room per se, but at some point in time it's a highly transmissible virus.
I get that, but that's not what I'm asking, because this guy got symptoms. Took him a day or 2 days or whatever. He called in sick. No one checked on him. I mean, he was a quarantine worker, not a breacher, if you like. You know, are there changes being made now that if someone gets sick who works in one of these quarantine hotels, that they call up someone or someone calls them?
There's a couple of things. One is they're being daily tested now. That commenced on the 29th of January. So there are daily tests. He was tested at least 3 times and found to be negative. But that approach has now been ramped up. That's one thing. I think secondly, Department of Health, Police, and of course the independent team led by Professor Wiraminthri will further augment what we presently know and what we presently do. There will be lessons learned, as we've found throughout this pandemic. And that is exactly the reasons why these reviews are happening.
And one more from me.
Sorry, Jeff, if I could just respond.
Sure.
Sorry, one bit further. It's clearly not perfect. I mean, we're dealing with a global pandemic, and I don't want to gloss over this as a catch-all answer, but we've seen from what's happened all over the world that we can't just treat this and say, well, that's the system in place and it's going to stay in, like that in stone forever. So we are adapting to the environment and the threat that we're facing.
And are you still confident that he didn't drive, didn't do any ride sharing from that date that you were told?
On the information I checked again this morning with one of my senior officers, we've checked with the 3 ride share companies, the major ones there, and there's no evidence presently that he has driven since the 22nd of January. But look, that's one of those things that we'll closely examine just to make sure and certain. So the sorts of things we do, of course, is review CCTV at service stations and those sorts of places, and that's the purpose of the inquiry as well.
Just back to the immediate...
Sorry,
Thank you, Commissioner. Sorry, Gary. Just back to the immediate kind of changes happening at the hotels. Have you upgraded the PPE to kind of counteract potential airborne transmission at the hotels? And also, I guess on that as well, is air conditioning something that's being looked at as part of your review?
Look, I'm aware of some of those issues, but they are Department of Health matters. I can say that there's nothing in the air conditioning systems. On the Chief Health Officer's advice, we had a conversation about that this morning, about it being aerosolised. There's no science that says you must have negative pressure rooms. It's physically not possible in these places. It is, of course, in a hospital setting, but there's nothing scientifically that the Chief Health Officer advises that we need to have negative pressure rooms in every situation of quarantine. In respect of other enhancements, certainly these inquiries will complement what we have in place now that's worked very well for 10 months. But now with this transmission having occurred, we will look at any opportunity to harden and strengthen the existing arrangements.
Which rideshare companies have you contacted, and has he provided an explanation for visiting 3 petrol stations in 2 days?
Well, that's exactly why police are complementing the health contact tracing. The 3 rideshare are the major ones. I'll get some of the pronunciation wrong, but certainly Uber, Ola and Dada, I think, if I've got those names right, we've contacted all 3 of those. So we will complement the contact tracing, and clearly, as I've mentioned, service stations. But look, I stress again, this person should not be treated as a criminal. He has voluntarily come forward and presented himself for testing. Yes, we've got some questions on the timings of all that, but he's cooperating, and so I just stress, police are trained to investigate. We do this daily. This will complement the work that's been done. We don't want to discourage other people from coming forward for testing. It's really important in public confidence that we know. The premise behind this is to establish what has caused the infection to occur. Can we strengthen it further? It's not for the purposes of finding guilt.
And the 66 close contacts identified so far, have they all been placed into 2 weeks of isolation? Will they all be forced to isolate for 2 weeks, or only until they return a negative test?
They've all been, well, on the advice we've got, the majority have been placed into isolation and are isolating. As to when we get results on that, I'll have to get Dr. Robertson to be able to respond to that if necessary.
Just on regional travel, you talked about the checkpoints being in place. What about flights to regional cities, Broome, Karratha, etc.? Will police be meeting those, or will they turn back people who don't have legitimate reasons to be travelling there?
Look, we will not at this point in time be meeting every flight in the regions. We want to make sure that the infrastructure keeps going, but the major resource companies we've spoken to are being very cooperative. We saw the system work well without any leakage and transmission over the past year in terms of that. And it's in these companies' best interests that we keep all of their work sites clean. That's why I think the cooperation has been very good. But no, police won't meet every single flight. We will where we can, if necessary.
Beyond FIFO though, what's to stop someone, say, getting on a plane to go from Perth to Broome for a holiday?
Oh, in terms of that, look, I've got police at the airport. We will, of course, continue to monitor all that, but we don't have it in place, a strict compliance in terms of that, other than people cannot leave their home and just simply go to the airport unless you are authorised. So we will be checking on that, to make sure you're simply not going to fly from Perth to Broome for a holiday if you're a Perth resident. So we will be checking on that.
Can I ask you about the security guard's place of residence? His neighbours in that block of units are wondering whether they should be quarantining. They apparently didn't know about this until they saw it on the news last night. There are bin bags filled with patient Zero's belongings that have been left on his doorstep. Police don't want to move them, apparently. So, how do you deal with something like that?
Look, I'm advised as recently as this morning, Department of Health have contacted all residents at that complex. We advise them all to go and get COVID tested. Certainly the inquiries will establish if there's any other information we presently don't have. But if I could just repeat, people that live in that complex, we ask you all to go and get tested. They've all been spoken to on the advice of the Department of Health, and we'll ensure that we do as much as possible.
And his belongings that are sitting on his doorstep?
First I've heard of that, Jeff, but certainly now we know that, we'll certainly cause any inquiries to be made.
When there was a case of in Brisbane, when they detected this mutant strain in the hotel and escaped quarantine, they evacuated the entire hotel. Why is that not happening in this case?
Well, I'm not an epidemiologist and public health physician, but there's one infected security guard, and I'm advised that there were a number of infected people in that hotel, 4, I think is the number, that have particular strains that we're concerned about. But look, I'm not the public health physician, so not for me to answer that particular question.
Are we continuing to use it as a quarantine hotel?
Yes, we are.
Is that the plan for going forward?
Look, the health department have not advised me that it's unsuitable, so what we're doing is examining the procedural issues about how the security guard got infected, but there's no information that's been presented to me to say the hotel is unsuitable.
You said the genomic sequencing has confirmed it's the UK variant, so do we know the exact return traveller that he caught it from?
No, I think Dr. Robertson would be best to answer that question.
Right, any questions for me?
Premier, obviously essential workers, there's a bit of confusion out there about schools are all closed. So what do they do in terms of vocational care or whatever? A lot of people seem to be worried that they're stuck now, they've got their children and they can't do anything about it. Whereas last time I think there were schools that were able to take kids.
Well, we've closed down now for 5 days. This is, at this point in time, a 5-day exercise. Last time, we didn't know how long it would go for. Indeed, it went on for months, as I recall. So it was a very different circumstance. It is difficult for families. I know this will be a difficult position. I've got 3 kids myself. I know it will be hard. But at this point in time, it's 5 days. I'd urge people to work cooperatively and understanding with family members to manage the situation they face. We have kept childcare open for very young children, because we know that for very young children it can be even more difficult, and especially for people that need to go to work.
In terms then of babysitters, are they allowed to come in for those who can't, for example, leave their kids with grandparents? Are babysitters allowed in, or do they count as visitors?
I don't have the exact details of that. I might ask after I finish the Commissioner or Chief Health Officer to comment on that one.
Peter Dutton was very critical of the shutdown. Were you expecting that?
Well, I hadn't thought about Peter Dutton in this context. I know the Prime Minister and the Federal Health Minister agree with what we've done, and they've said that publicly. So Prime Minister is on the same page with us, and I appreciate his support. In relation to Mr Dutton, I just want to make this point. He's the Minister for Home Affairs. They have the responsibility for quarantine under the Constitution, but he doesn't want to do that. So therefore, it's fallen to the states to perform the role that Mr Dutton should be performing under the Constitution. So he shouldn't be criticising when we're doing the task he should be performing. Under the Constitution, Section 51, quarantine is the responsibility of the Commonwealth. And they have facilities. They have Christmas Island, they have defence bases, all of those places, sometimes in very remote locations. They're not doing it. They refuse to do it. So therefore the state's doing it. So I just urge Mr Dutton not to be a critic.
You're launching a review that will look at learnings from other states, Victoria obviously did a massive review that reported back in November. Why didn't we adopt any of the recommendations or all of the recommendations from that review?
Well, hold on. We have consistently upgraded and improved our systems over the course of the last year. It's been a consistent, ongoing process to review, improve. We did 3 reviews. There were 3 reviews that have found our systems to be sound. Obviously, this event has meant that we will now do a further review to see what else we can do to make sure our systems are sound. And we'll have a police inquiry into these specific circumstances. This is not something we anticipated, although it has happened in virtually every other part of Australia before. But we're now doing our best to deal with a difficult situation.
One of the criticisms, though, was secondary employment. Will you move now, in the interim, to stop secondary employment, even if you've got to pay the people there more money?
Thank you. That's a very good question. We have been working on that for months. I've requested Health work on that now for at least the last 3 months. That is it is a complex issue to resolve. We're nearing a resolution. We expect we'll get to a resolution in the course of next week. And it may well involve additional payments for people who work in the hotels, in the quarantine hotels, in particular those people who are required to be tested, saliva tested or PCR tested during the course of a week. So that's the resolution we're heading towards. Saliva testing, we decided to do that on January 8. We managed to roll out the system on January 29. So it took us 3 weeks to get the system in place. Bear in mind, it's a big exercise that, testing basically hundreds of people every single day. With a testing regime in each hotel was a big exercise to get there, and we've done that, and we have weekly PCR testing. The individual involved, I'll repeat again, was tested on 3 separate occasions and returned a negative test each time in the lead up to him becoming infectious.
Why is it so difficult, though, to say to someone, if you work in hotel security in a quarantine environment, you don't hold a second job?
Well, the advice I have is often around enforcement, and we're working with private security companies. So we have been working on it. It has been difficult. We're hoping to get to a resolution next week.
So at this stage, do they actually sign something that says, I won't do a second job?
I'd have to get the Chief Health Officer or the Health Minister to comment on that.
We all do. And we don't work in hotel quarantine, but we can't hold down 2 jobs.
Yeah.
It doesn't seem that difficult for me.
That's right. This individual, just so all of the advice I have, having checked with rideshare companies, is he did not do any second job work after becoming infected. He did not do. Hold on.
But that was just lucky.
He did not do any second job work after becoming infected. And also make the point: you can work in a hotel as a cleaner, as a security guard, as a nurse, as a doctor, as a police officer, as an administrative assistant, and you can still go about your daily business. You can still go to shops, you can go to nightclubs, you can go to hotels, you can go to restaurants. We can't control that. We can't lock people up who work in hotel quarantine. They can still go out there and do all that. A second job is obviously something we will deal with, but it doesn't stop people living a life. And that's why we're reviewing the systems inside the hotel to determine what happened here, to see if there's anything more we can do to keep the hotels secure.
Is there any urgency in the review, in bringing in these, no second job or the daily testing? Because that was one of the criticisms from the AMA that, we've kind of been slowly implementing these things when the virus, could be spreading now.
We brought in PCR testing last year on a weekly basis. That's the up-the-nose swab on people. And this person was tested 3 times during January. So that's what happened. In relation to daily saliva testing, which is not as accurate as I outlined yesterday, but worthwhile, we decided to do that on the 8th or 9th of January. We rolled out the initial trial in one hotel, the Novotel I think it was, on the 20th of January, 11 days later, and we had the full system operational by the 29th of January. So, that was relatively quick to get that. Hold on, if I can finish what I'm saying. Can I finish what I'm saying? So that was relatively quick to get that system in place with all the appropriate protocols and all the services and the like. And indeed, we had to sign contracts with various companies that put it in place. So we did that over the course of that period of time. So these things, you know, we have consistently improved our systems since March of last year, and no doubt over the course of this year we will have to consistently improve our systems as we pick up the learnings of other states and other parts of the world.
Did daily testing start, saliva testing start at all hotels on Friday? We've had reports that it wasn't in place.
I'll let the Chief Health Officer comment. The advice Health has given me is the 29th is when it commenced. But just going back, it commenced on the 20th in the Novotel.
Do we know yet if he has the UK strain? I think there was a bit of confusion about that.
The advice is he has the UK strain. We don't know from which person in the hotel he acquired it from. So that's the further testing we're trying to work out, which person inside the hotel he acquired it from.
Should the other people staying and doing their quarantine at the Sheraton 4 Points be concerned for their health, given we don't know how the guard contracted it?
No, the advice I have is not. We checked, I saw a story online about the air conditioning this morning, so we followed that up. The air conditioning is not a recycled system inside the hotel. It vents to the atmosphere. So that was inaccurate. So the advice we have is the air conditioning system is safe, and there is no evidence that there is any problem with the air conditioning.
So
We're going
is
to
there
have
a
to open
chance
up
then
more
that
testing clinics, given the lines are being extremely long, kilometres down the road in some cases. So we're going to have to open them.
We are ramping up the systems. We're increasing the hours. We're putting more staff on. We're looking at putting one into Maylands, a pop-up COVID testing clinic in Maylands to deal with people who live in the proximity to Falkirk Street as we speak. We're doing all we can to get these systems up. I just urge people to be patient. Every state has been through this. Every country has been through this. When there are these situations, there are time frame issues, and that's because doing these tests is a very particular process and a time-consuming process, and it requires all sorts of cleanliness protocols to be implemented that can't be rushed. Sorry, Emily, you had a question? Okay, Jeff?
Yeah, the people who have been saying they can't get masks, they can't find masks. We know that there are some chemist shops that have got signs out saying they've sold out of masks. Is that just like because it's only early days, or will you have to open up the warehouses that hold 5 million masks and distribute them?
Well, some months ago, I instructed the agencies to acquire masks just in case this occurred, which was, fortunate, I think, that we're in that position. We now have millions upon millions of masks in our system. We've distributed them around the state, so there's areas all over the state that literally have hundreds of thousands of masks available, should they be required. What we don't want to do is create a rush. To be frank, we asked people to acquire masks months ago, but we don't want to create a rush where we suddenly have huge lines at police stations or at council offices or whatever it might be. So what we're doing is we're working with NGOs, non-government organisations, so that people in need can acquire a mask from them. If police observe someone walking around without a mask, they will have masks on hand to distribute to people. We're trying to do it in a very orderly way, by which we make masks available without creating pandemonium. And when you make free masks available, I expect some people who already have masks will go and line up for masks. So we're trying to avoid that situation with a very carefully calibrated way of distributing masks out to the community.
When was the AHPPC first informed of the positive case?
I'm sorry?
When was the AHPPC first informed of the positive case?
I don't think it has met since when I was informed yesterday morning. I expect at the next meeting of the AHPPC it will be advised of the situation. But just so you know, we advised the Prime Minister and the other premiers, or I did personally, yesterday before we announced it publicly.
Are you able to explain why, when the security guard called in sick on Thursday, he wasn't advised to immediately go be tested for COVID-19?
I don't have an answer to that, but I understand, as I said yesterday, I'll get the Chief Health Officer to comment. The exact order of events were these. Phoned in sick on the earliest he could have become infectious was the 25th of January. The earliest he could have become infectious. He developed some symptoms on the 28th and phoned in sick. The next day, the 29th, he went to a doctor to get himself analysed. The following day after that, the 30th, he was COVID tested at a COVID clinic, and obviously we got the results late, midnight on the 30th. So as to what he was advised when he called in sick, I don't know. All I'd say about that, and maybe the Chief Health Officer could comment on that, all I can say about that is sometimes I'm advised, sometimes the symptoms are not what you might think. So someone might have diarrhoea and be COVID positive when you think the symptoms might be respiratory. That's what I've been advised. So, sometimes you might feel you might have a headache and you might think it relates to something else when it's actually COVID. So therein is the problem. But I'll let the Chief Health Officer comment on that.
Premier, just one more to fire you up. John Barilaro, the New South Wales Health Minister, is he?
No.
Deputy Premier, apologise. He says WA's hard domestic border lockdown has proved pointless. I strongly recommend the WA Premier considers adopting the New South Wales strategy.
Well, he's wrong. He's obviously wrong. Having borders helps. That's why the Commonwealth has borders internationally. That's why when New Zealand had cases last week, they locked the border to New Zealand. Clearly borders help. I think that's staring us in the face. It's just common sense. Unfortunately, New South Wales, I don't think has learnt that lesson.
Do you have an update on the Fiona Stanley Hospital patient that is a historical case, or whether that person actually poses any risk to the community?
The person who was in the paper today?
Yes,
yeah, okay. The advice I have, he does not pose a risk. The health advice, don't worry, I've interrogated this at length. The advice I have is he is not a risk. He is an historical case. He was in hotel quarantine in Sydney, having returned from overseas. He went through 2 PCR tests, which both came back negative. That's the very accurate nasal swab. The advice I have is he may well be what's called a shedder of the viral load, as opposed to a spreader. And so that's the advice at this point in time. We're awaiting final tests on him today, but apparently we've had 49 of these people already who are shedders as opposed to spreaders, who present with these symptoms.
Should there be some kind of improved communication from the government? Because just in this room before you guys got here, we're all discussing the rumours that have been bandied about that potentially there was a 6-week lockdown with 30 new cases. Is there room for?
Let's just
improve?
We just do that.
Yeah, but
that was carrying on Twitter.
These are just people out in the community that are, the rumour mill's going wild. So is there any room to improve that communication at all?
We put out huge amounts of information. In fact, sometimes I think there's information overload when it comes to COVID. But we put out material online, we put out statements, we put out Facebook posts, we do hour-long press conferences if required, hour-and-a-half-long press conferences. We do everything we can to communicate with the public. Obviously paid advertising is one other thing we can do, which we'll consider. But we're trying to communicate as much as we can. The rumour mill in these circumstances is understandable, and people being frightened is understandable. We just want everyone to be calm, listen to the advice, do the right thing, stay home, get tested. If you're sick, get tested. If you have any sort of symptoms, get tested. If you visited any of the venues, get tested. If you're in Maylands in proximity to Falkirk Street at all, go and get tested. That's our advice to people. If you've met anyone who's been to those venues, get tested. So that's the best thing that people can do. Obviously our testing rate is going up significantly, and it's hot out there, and it's difficult conditions. So just be careful, take a hat, take water, wear sunscreen, but please, if you're in any of those categories, go and get tested.
Just back on schools, some teachers have been told to start preparing for online learning. I guess, is there any truth to that, and what kind of reassurance can you give parents who've got kids?
Well, our expectation is at this point in time school would go back next week. But there's nothing wrong with teachers preparing for online learning. I think that's a reasonable precaution. And so I'd urge teachers, teaching staff, just to prepare for that. And if they have to go and get the materials they need from the school to undertake that preparation, that's a good thing. But our expectation at this point in time is schools will go back next week.
Just on the no new cases, is that up to the end of a certain reporting period, or is that up to this moment?
Well, we get reported every day, in particular from the COVID clinics, and there's no new cases out of that at this point in time. But obviously, figures come in all the time. So the private clinics, any of the outlying COVID clinics, sometimes the figures come in a bit later. But at this point in time, we have no new community cases. Obviously, if we get any, we'll update you immediately.
Do we have any, sorry, again, reports of people being treated, these might be shadows of people being the 3 infected people in hospital around WA being treated? Is there any truth to that?
I'm sorry?
Is there anyone infected with COVID being treated in any hospitals in WA at the moment?
No.
There is we have no inpatients in hospital with COVID-19.
No, they're all managed in hotel quarantine because they're not sick enough to go to hospital at this point in time.
There's reports of a 40% increase in pay for security workers, is that correct?
Well, that's what we're working at. Working on those sorts of options about people who work in hotel quarantine, especially those people who are required to be saliva tested on a daily basis. That's the sort of thing we are working on. As I said, we've been working on it for some considerable period of time.
Is a proposal on the table for a 40% pay increase for security guards and cleaners?
That's the question I just answered.
But just asking, is that the specific?
We're looking at those sorts of options currently.
Is there any support being offered to the homeless? Advocates are saying that this is a hard period for them, that many of them don't have homes to actually isolate it.
We have $100 million a year we spend on homeless services across Western Australia to support people into supported accommodation, to provide services to people. If people who are living in any way rough require a mask, obviously there are organisations out there, NGOs, that will provide them to them, and indeed police will provide them to people if they need them.
So you're confident that we have the existing services already to deal with?
Well, as you know, over the course of, this has been an issue recently. We've put a whole range of additional services in place and we're continuing to do so. As I've said before, when people access those services, they need to make sure they behave appropriately. And so we had some cases recently of people who were housed and then drug use and violence occurred, so they were evicted. I just need people, when they access these services, to behave appropriately.
Does essential retail extend to office supplies, electrical equipment and so on?
Bunnings?
Well, it certainly has hardware on it, as to some of those other goods. Many of those sorts of places, for instance, I think JB Hi-Fi and those sorts of retail will be closed.
If there are more positive cases than this one, how likely is it that the lockdown would be extended?
Well, that's a hypothetical question based upon health advice. Obviously, we're very hopeful the measures we have taken to crush the virus will work. That's the aim here. We currently have one case that was in the community. It was the virulent UK strain. That's why we've taken the actions we have to crush it, to make sure it doesn't get a foothold in Western Australia. As we know, with a virus like this, there are no other solutions. This is the only solution that is there. The vaccine hasn't rolled out yet. The vaccine won't fully roll out till late this year. There is no other solution apart from what we are doing. The idea that we just let it manifest in the community and don't take harsh action is not the right model, and that is not the model we're adopting. We're adopting a model to try, like Adelaide did, like Brisbane did, like Northern Tasmania did, and like Melbourne did, to crush the virus in its tracks.
Is there a requirement for people who are being tested to then self-quarantine? I know it's a lockdown, but then to self-quarantine, not go out to the shops, not go and buy petrol or go to the chemist while they're waiting the results of their test?
Yeah. Yes. So, just urge everyone to do the right thing. We need common sense here. Stay home. If you don't have to go to work, stay home. If you don't have to go to the shops to get groceries, stay home. If you don't have to go to the doctor, stay home. Just do the right thing by everyone in Perth, Peel and the southwest, and we should get through this.
But I think that's what people are struggling with, is clarity around some of these issues. So that's why furniture shop, barbecues galore, the lighting shop
Yeah.
open today because they could open last
Yeah.
time, you're saying they should close.
Yeah.
People who get tested at one of the COVID clinics should then just jump in their car and go home and not go to the shop on the way.
That's right.
Yeah.
Yeah, common sense. Common sense is what's required here, and doing the right thing by your fellow citizens. So that's what we are asking people to do here. The police are not going to take a heavy-handed approach. We don't live in a police state. But what we're requiring West Australians to do is use their innate common sense and just do the right thing in this difficult time, and we should get through this. Thank you.
Andy?
Andy, just
Please.
Is there a protocol already in place, regardless of any review, which says when a quarantine hotel worker calls up and says, I feel sick, that the person at the other end of the phone says, we'll notify the health department?
So we're still getting details of exactly what actually happened. But when he became unwell, he went and saw a doctor. He became unwell on the Thursday night. On the Friday, he went and saw a doctor.
At 5 p.m. the next day?
He did.
Yeah.
At 5 p.m. that next day, and then he was managed by that doctor. He got tested the following day. Obviously, we would have preferred. He rang in on the Saturday to say, I'm unwell and I'm not coming into work. We would have preferred that he did it at an earlier stage, as soon as he became unwell. But he, as has been mentioned, symptoms vary, and often the symptoms can be actually quite mild. They can be, and particularly in the younger age group, they could be, just feeling a bit tired. Those kind of symptoms that are not specific. They're not easily identifiable, and he may have thought he had something else and went to the doctor as a consequence. That's why.
But there is no process where that security company is contracted to notify the health department that they have a person.
Oh, if the security company is notified, yes, they will notify us.
And did they?
I'd have to check that.
Well, what I mean is, did they tell you that one of our workers is now feeling sick and has going off to be?
Well, they told him he was sick and that he wasn't coming in for work. I can check whether in that particular case he was.
Doesn't need a review, does it? I mean, that's pretty basic that in this environment you'd think someone would call up and say, we have a sick worker.
They can be sick for multiple reasons, of course. He could have had a,
But he wasn't. He was sick because he.
But he was being tested, and he was asked to be tested. So and we got the results, and he didn't work whilst infectious at the quarantine hotel.
What were his symptoms
Sorry?
Were his symptoms non?
I can't go into this. We have to be a little careful. He had symptoms that are consistent, but they weren't necessarily respiratory symptoms, but they were consistent. Could be consistent with COVID-19.
Is someone now within the health department or anyone now contacting, email, ringing them, whatever, the security companies and everyone who works out in that hotel quarantine and says, okay, we've had a wake-up call. If now you start feeling it, you've got to tell someone. You can't, and don't go shopping.
Is
that changing?
That's always been the protocol. Is that people are, if they become unwell, they should get tested.
It didn't work. That's the point, Andy.
But people are individuals, unfortunately, and they, all of us do. People make decisions that, in retrospect, they shouldn't have done.
So it's human error. The system didn't fail. Is that what you're saying?
I'm saying that we continue to improve the system as we go along. There was obviously, we would have preferred that he contacted us as soon as he became unwell.
Yep.
It's good that he got tested on the Saturday, and obviously we've acted rapidly once we had that test.
So my question is, people who are now working in hotel quarantine, being told you have to do this. You can't just please yourself.
They have been told in the past, and they will continue. And we will continue to reinforce that message. Yeah.
And any okay, sorry, thank you.
Yeah.
So given the air conditioning has already been looked at, which the Premier mentioned.
Yes.
And the security guard has been working well with police. as the Commissioner
Well, with our
mentioned.
contact tracers, yes.
Yeah, sure. Is there a chance that he could be lying then? Given we don't know how he's caught it. Like, you can imagine the fear that's in the community at the moment, where the disease, he didn't go into a room, he hasn't been in contact with anyone, and apparently it's not airborne. So it's like, okay, well, how did he get it?
So
Any other way about
he has been very cooperative with us, and he's, you know, and that's where, you know, all those details of the different sites have come from, have obviously come directly from him. Whether he has actually told us everything, we've continued to talk to him. With police doing a forensic investigation, they're very good at checking, you know, both in, obviously, very good at doing the interviews, but also in being able to check all of what he says and whether it's, and then to challenge if there seems to be gaps in the story. So our contact tracers are doing that as well, but look, there may be omissions from the story, and we will continue to follow those down, but he has been cooperative at this stage.
So even though air conditioning has been ruled out, has the PPE at that hotel in particular been upgraded?
The PPE, the guard was compliant with his PPE, and as far as we're aware, all of the other security people, there has been no breaches of PPE in that hotel. They have been compliant with their protocols, they've been carrying the PPE, they've been wearing it when appropriate.
So just while I've got you, sorry.
Yeah.
Just while I've got you, just back on the babysitter issue. So what's the rules surrounding that for essential workers who can't give their kids to childcare centres because they're school age? Are they allowed to have babysitters come to their house? What's the protocol there?
Look, it's one that we haven't looked at, and I think we're going to have to review that. I think we should be, where possible, minimising people coming into the house, particularly people who aren't part of the household, but do appreciate that if they're essential workers, that we may need to look at how that could be facilitated in a minimal number of cases.
Shouldn't that have been done though when the decision to shut schools this week was made?
As you can imagine, there were a lot of decisions made yesterday, and we covered a whole range of those. There will be a small number of issues that will arise out of them, and they obviously have. You know, we've had the discussion today about retail and things like that. There are issues, and we obviously need to continue to look at how they play out, and then we'll make necessary changes if required.
Was saliva testing carried out at all quarantine hotels on Friday?
I need to check that. It's certainly, my understanding is the directions were signed on Friday to enable that, and then they were certainly all were progressing from the 29th.
Andy, I think you said yesterday that we would expect to see more cases. I think it was Wednesday.
Well, just working on the average incubation period, obviously is between 5 to 7 days for this disease. So working on that basis, the most likely contacts are his close contacts who are all in hotel quarantine. And to answer the question before about what happens if we get new contacts, it depends where they are. If they're all in hotel quarantine and don't pose a risk to the community, that's a very different picture, and it may be a very different approach to if we have a number of cases in the community. So that's why we have to look at that. But yeah, so we're working on the incubation period. By midweek, most of his close contacts it'll be 5 to 7 days. If they're still, and we'll be retesting them, if they're still coming up as negative, then we'd obviously look at that would be a good thing, good sort of sign that this person wasn't a particularly effective spreader. And this is what we're not quite sure on.
If though one of his close contacts tests positive while in quarantine, but they only went in while in hotel quarantine, but they only went into hotel quarantine yesterday, there's the risk then that they may have infected other people. Would they have been infectious then?
So we've we've identified his closest contacts, the 13 very closest, and that obviously includes his flatmates, the doctor he saw, a number of others. They're all negative, so that's actually good, so that they are not posing a risk to the community at the moment. We'll obviously get the results for the other 53 of his close contacts over the next day. If they're negative, then they obviously pose no risk to the community. Obviously, if they are positive, then we will do whatever contact tracing is required.
Can you define a close contact? Sorry, can you define what a close contact is?
Well, it's usually somebody who's been, in close contact for 15 minutes with the individual, or spent time with that individual over a number of days. So, people obviously he lives with, those kind of things. But there will also be casual contacts. Somebody he meets passes by in a shop or something. Going into a shop as somebody's coming out. So we are tracking those down, and so we've got over 100 contacts that we're looking at the moment. About 66 we consider close. Obviously, the 13 we consider the closest ones are obviously the friends, and they've all been tested, all negative. We're moving on to that next group, and then and obviously the casual. All of those people have been put into 14 days quarantine. So
100 of those people?
Yep. Well, all of the ones who have, of the 100, the 34 that haven't, some of those are casual contacts, and some of them have had no contact with him. So when we've actually called them up, they were in a different place at the same time. So as you can imagine, we've had some reports using things like the Safe WA app, that they'd been at a cafe, for example, or a place that he'd been to, but they might have been there an hour before him, and then we've been able to exclude them. But any casual contacts will be put into quarantine as well.
And there are 66 people currently in hotel quarantine. Can I just confirm that number?
No, there's 66 who are in either hotel or home quarantine. There are 11 who are in hotel quarantine at the moment.
So you've got the test results back for the 13 closest contacts,
yep.
all negative. You're still waiting for the test results for the other 53 close contacts.
That's correct.
And regardless of whether they test positive or negative, they'll have to quarantine.
Well, they're all in hotel. They're all in home quarantine at the moment.
But if they return a negative test, they still have.
They will still have to. They're still close contacts. So, again, remembering that the tests are a point in time. So, they still would have to do 14 days of home quarantine.
And of the 3,171 tests yesterday, were all of those results included in today's report of no new cases, or are you still waiting?
It takes up to 24 hours to get the results out. You probably, a lot of the results are already going out. So, we've had reports already of how quickly people are getting negative tests. We SMS people with their tests. So, but it does take a time to move them through the process, because the full process is around 4 to 6 hours to do the test.
And how many tests can we process a day?
We can process probably up to 18,000, 20,000 tests a day, but that utilises the various other labs as well, including the private pathology labs. And I should probably make the point on the labs. So we've normally got 7 COVID clinics here in WA. There are now that are collecting. We've been working with Western Diagnostics, with Clinipath, and with the Australian Clinical Laboratory, and with the Commonwealth. And so that is now 25 at the moment. So, so people don't have to just go to our COVID clinics. I appreciate there are long queues at some of our COVID clinics, but they can go to now any of those clinical laboratories. Some of those are drive-through. So that's, we've literally gone nearly 4 times over what we had yesterday to today. So we're anticipating we'll see a lot more testing done today, and hopefully a lot less queues.
On the daily saliva tests, are they self-administered? And why saliva tests and not daily PCR testing of quarantine workers?
So they are self-administered. People are obviously directed how to do them. They do it, they place it into a container, and then that's obviously sent off for a PCR test. So saliva testings are not a different test. They are PCR tests. So the modality that tests is the same. It's just how you take it.
So saliva rather than down your nose.
It's saliva rather than oro or nasopharyngeal. The reason we don't do that is, have you had a nasal or oropharyngeal test? Having had one of those, you'll appreciate that you may not want to have it every day, and it's obviously beneficial. People can do an oral swab on saliva a lot more easily.
Andy, just one more from me. We're all being bombarded with text and questions. Can we just get some clarity, please, around a mum with 3 kids, and whether you can exercise with the 3 kids, or you just take one at a time, or given that you've only got an hour?
I might.
I've got just one more. The case reporting period, is that from 8 a.m. to 8 a.m. or what's the 24-hour cycle?
So the 24 hours is from 8 p.m. to the following 8 p.m. So we had no. So the reason why the case was not reported in the previous days is because obviously we got the results, around midnight. So it's been reported in today's figures, so that's where the 903 comes from. But we can also, obviously in these circumstances, if we have had any further cases overnight, we would report them, and I can just to confirm that we haven't had any further cases overnight, and but it usually goes from 8 p.m. to 8 p.m. each day.
Thank you. Just quickly, what was the reasoning behind the 5-day lockdown? Why 5 days when Queensland did 3? What's your reasoning behind that?
Look, I think South Australia did 6. Obviously, Queensland did 3. We looked at 3 and 5 days, but felt that because of the incubation period of the disease, if we were getting contacts in that, we would be able to identify them to within that period of time, lock them down into home or hotel quarantine, and then manage them and hopefully get that under control, and make sure that it wasn't spreading in the community, and then look at the end of the 5 days as to whether what the next steps might be.
Do you think that you'll recommend some restrictions remaining in place if we do happen to have the week of no cases?
Look, I think it will very much depend on the next week, on the situation we find ourselves in towards the end of the week. But obviously, if in an ideal situation and we've managed to restrict it to just one individual, then will be very different than if we have a number of cases.
Thanks. And the Commissioner's going to finish off.
Yep.
Could I be bold enough to say, look, I'll just address 2 matters, and we've got to get on with this emergency. I know you've got lots of questions and SMSs. I'll challenge you that I've probably got more. Can I just say this? Childminding, you can do it at home. So all child care centres are open and will remain open unless the operator chooses to close it, but they're not being restricted. They can remain and are remaining open. If you're an essential worker and you can't, and we appreciate we've closed schools for this week in the Perth, Peel and Southwest, and you don't have anyone to look after your kids, you can't bump them into a childcare centre, you can get someone to come into your home and childmind in your own home. That's permissible under the directions. So just to clarify that particular point. We need to move on to other matters. Annie's answered that last question, which the Minister for Health just reminded me about. Can I just appeal to people going for the COVID drive-in clinics? There's 16 of those that are available in the Metro and Peel regions and down in the southwest. If you can't go to the hospital and sit in a queue, you can go in a vehicle. I've just received reports as we hear about 1 or 2 kilometres long of that. It's a hot day. Be common sense about this and be also compassionate, because there are older, vulnerable people who health are asking to get to the front of the queue. If they're vulnerable and old, then be the good neighbour again and just be sensible about it. Thanks very much.
No, what about the mum with 3 kids, Commissioner?
Oh, exercising. No. Look, on the clinical advice, 2 people maximum. So look, if you're a parent at home and you've got 3 or 4 kids, you can only do 1 at a time, But look, let's be neighbourly about this. Get someone in to help. If your partner, spouse is a worker, then just share that responsibility around. But a mother or a father can't take 4 kids out and there's 5 together. That's the clinical health advice. This is until Friday. We will review that. It's a hot week. Look, just stay inside as much as you can. We know that it's tough with little kids in particular, but we just ask for adherence to that.
Just quickly on that, there's an emergency level bushfire in Mundaring. Obviously it's part of the lockdown area. What are people meant to do? They're told to evacuate, but there's stay-at-home orders. What's the advice there?
No, it's quite clear under the arrangements. If you're in an emergency warning area, you must leave. Don't stay home.
Thank you.
Okay.
Thank you. Final count on this morning.
Sorry, I had to get that one in.
Hey.
Pretty good.
Good. How are you? Yeah, great. Busy?
Are we trying to kill Fiona or something?